I have a very limited control. There's so many unknown. So it's in my best interest to trust the process and trust my healthcare providers and trust my body and trust my baby that my baby knows how to be born. Ladies and gentlemen, welcome to my channel. My name is Claire. On this channel we discuss everything living with HIV and motherhood. In today's video we're going to discuss about a birthing experience. As a woman living with HIV, should you choose vaginal delivery or C-section delivery? Vaginal delivery is also known as natural birthing experience, and the C-section is a procedure where they open the abdomen of the mother and cut an incision in the uterus and pick up the baby. Both vaginal delivery and the C-section delivery are great, and they have advantages and disadvantages. When it comes to women living with HIV, if a mother has maintained an undetectable viral load or viral suppression throughout the pregnancy, the best option should be vaginal delivery. However, women have different options. They can choose to have a C-section for other reasons. Advantage for birth, for natural birth or vaginal birthing experience, is that the process takes longer, 12 to 18 hours or more, but the woman heals from delivering a baby faster than when the woman has received the C-section. And also another advantage is the shorter stay at the hospital. While a woman who has received the C-section may have to stay longer in the hospital, a woman who have been delivered vaginally, the baby will have a shorter stay at the hospital. And also the recovery time. For vaginal delivery, the recovery time is quicker compared to the recovery time from women who have received the C-section. As women living with HIV, we should be able to discuss our birthing experiences plan with our healthcare provider way before the D-Day, the delivery day. After 20 weeks pregnant, it's a good time to sit down and think which birthing experience we want as women living with HIV, and discuss our birthing option with the healthcare team, so we're not surprised at the last minute and feel like we were forced to do what we didn't like or we didn't enjoy our experience. And also for women living with HIV, transmission or passing HIV to the baby is not zero. It's still below 1% in the United States. This can happen when the baby is in the womb, or during delivery, or during breastfeeding. So the goal of you working with the healthcare provider team is to minimize the risks at each level. The risk of the baby being getting HIV in the womb, or during delivery, or during breastfeeding. That's why it's key to start this conversation as early as you can, because each woman is different, and the healthcare provider will be able to make a plan according to the mother's needs. A viral load plays a big role in deciding which birthing experience you will have. The goal here is to minimize the risk of passing HIV to the baby during delivery during breastfeeding and when the baby is in the womb. My big recommendation to fellow women living with HIV is to take HIV medication as prescribed, maintain a positive attitude, and eat healthy, rest. The rest, God is in control. And another point is to remain open-minded, because stuff may change at the last minute. So be flexible to changes and trust the process, trust the healthcare provider, trust your body, trust the baby. They know how to be born. Your body knows what to do. So don't fight back when at the last minute they say, oh, you know what, we should give you a C-section. And just because you know vaginal delivery is much more easier, you start saying, no. Or they say, you know, it's safe to have a vaginal delivery. The baby is engaged in the birthing canal. And then you say, no, I just wanted a C-section. So as a woman living with HIV, a pregnant woman living with HIV, we should be open to be flexible to changes that may happen at the last minute, knowing that the focus is the interest of the baby and the interest of the mother. In my opinion, I prefer vaginal delivery. For my 2 sons, I have had vaginal delivery. And the pain, yes, vaginal delivery is painful compared to C-section where you feel nothing. But the birthing experiences are different for each baby and for each woman. And we have medication that helps to manage the pain a mother can have. For my first baby, I was in labor for 48 hours. And for my second baby, I was in labor for 3 hours. So the birthing experience, it's not a copy-paste situation. You should always trust the healthcare providers. My big recommendation to fellow women living with HIV is to take HIV medication as prescribed, maintain a positive attitude, and eat healthy, rest. The rest, God is in control.